Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Welcome, beautiful people that I love. Welcome to Organic Healthy Lifestyle, and I'm Nancy Addison, your host. I always start off my show with a prayer, and I ask you to join me in whichever fashion you would like. And I ask our divine creator, thank you for this new day that you have given us. Today, please help us to focus more on what is right instead of all that is wrong. Help us to change what we can and leave everything else in your hands. May your joy be our strength and your peace fill our hearts. Help us to remember that any burdens we face are meant to rest on your shoulders and not ours. What is too much for us to bear is not too much for you, and you will help us handle all that we are given. And we ask this in the highest good of all concerned. Thank you. And so it is. Today, y'all are in for a spectacular treat. One of my favorite people in the whole world, Dr. Thomas E. Levy, board-certified cardiologist and lawyer, and author of some fantastic books. And he has written some incredible books called, here are a few of them, Primal Panacea, Curing the Uncurable with Vitamin C, Death by Calcium, Magnesium, Reversing Disease. I believe, in my opinion, he is one of the leading experts on vitamin C, and he will expand on some of these topics as we go through this show. And this is part 2 because we had him on before, and I got knocked off my internet, and it was a little shaky there. And he has been so kind to join us once more. Welcome to the show, Dr. Levy.
Hi. Great to be here.
And we can't see you. I don't know if you have your video off or if you just want it off, but you're welcome to turn it on if you would like.
I can see Dr. Levy.
Oh, okay. Then that's just my computer. Heavens. Well, goodness gracious. And here I got a new computer and everything. So, Dr. Levy, last time you were here, we were talking about magnesium and vitamin C, and I have had so many people asking me and having the desire to get off of medications, and many of them are on medications for high blood pressure. And I would love for you to share your thoughts on how people can get their blood pressure under control without using pharmaceutical drugs.
It's a good question. And I must say at the outset, so people don't get the wrong idea, is it's very difficult to control clear-cut high blood pressure without prescription medications. Now, there's a lot of things we can do in the orthomolecular medicine arena that makes it more manageable. But there are a number of factors involved, and it's just not very common that somebody who has had legitimately significant elevated blood pressure to get complete control. And when I say complete control, I mean, some people, they'll wait till they're relaxed and they'll finally do a blood pressure and it's fine. That's not a reflection of your blood pressure 24/7. Okay, and there are ways of checking it to see if you have that type of control. But you don't want to be running, systolic blood pressures of 150, 160, 170 any percent of the time. And you don't really want to have your diastolic blood pressure, the low part, above 85 to 90 any percent of the time. And I want to emphasize that at the outset because, and I share this sentiment with most people, is that yes, most prescription drugs are highly toxic and you don't want them anywhere near your body, much less inside your body. But that's not the case with blood pressure. In my years of practicing cardiology, they actually have medications, which are called calcium channel blockers, of which magnesium, as you mentioned, referred to, is a natural form of a calcium blocker. And these types of drugs not only frequently control blood pressure completely effectively, they do it while, this is incredible for prescription drug, reducing all-cause mortality. So when you take this type of medication, you decrease your chance of death from all causes, which is because elevated calcium inside the cells is truly the final common denominator for all significant pathology, marking increased oxidative stress inside the cell. And that's what you need to avoid, this increased oxidative stress. And when calcium is up, it's always increased. When you can bring it down with a calcium channel blocker prescription or a calcium channel blocker magnesium, that can do the trick. Basically, though, like all the other chronic degenerative diseases, high blood pressure just doesn't arise for no reason at all. It typically arises for the same reasons that all other chronic degenerative diseases arise, which is unchecked new toxicity on a daily basis. And this is almost always comes from the mouth. So if you have someone with root canals, a couple of infected teeth that don't hurt, chronically infected tonsils that look normal, low-grade chronic sinusitis, all of these things predispose you toward all the different chronic degenerative diseases, of which high blood pressure is only one. And everybody seems to have their own significant, shall we say, genetic predispositions, which means if you put the same toxic stress on 100 different people, you probably get predominantly 5 or 6 different common presentations. Some would present with chest pain, others would present with high blood pressure, others would start developing cancer, others would develop chronic fatigue. So there's just no set pattern as to how one given individual will respond to a new, unchecked source of ongoing toxicity, which is, and this is in the book, Hidden Epidemic, nearly always due to dental toxicity, which we may or may not talk about more as we go on. But anyway, I just wanted to start out because it drives me crazy. I see these commercials on TV where somebody has this machine and they squeeze it and all of a sudden their blood pressure comes down to normal and then they stop all their medications. Not a good idea. Anybody that knows me knows I'm not pro prescription medicine at all, pretty much with the exception of high blood pressure.
Okay, that is so good to know. And every once in a while, I run into people who actually have had situations with low blood pressure. So, do you have any thoughts that you can offer us on that?
Well, truly, unless you're really passing out or severely fatigued or having trouble staying awake, you can't have too low a blood pressure. So, I mean, some small women might actually have a blood pressure of 85 over 60. That's fine. That's normal. If they feel well and they have normal energy, I mean, it's you can't have too low a blood pressure if you're feeling fine. And I mean, then that's just really without symptoms. The lower your blood pressure goes, pretty much the less your incidence of just about all diseases. So now there are conditions, circumstances under which low blood pressure is associated with symptomatology, and that's a broad topic. Involves a lot of different unique conditions beyond which we can address here, but those certainly do need to be appropriately evaluated and treated if at all possible.
Okay. So I know that vitamin C is one of your really important supplements that a lot of people need to take. And I'm wondering, so many people tell me that they have had Lyme disease. And Lyme disease has actually also got the exact same symptoms as an overload of electricity in the body from electromagnetic field, like radiation from x-rays or radiation therapy or things like that. And so would vitamin C be something that, or what do you recommend, or what are your thoughts on Lyme disease?
Lyme disease is a great imitator, sort of like mercury the toxin. Take too much mercury, you have about a dozen different syndromes of symptoms that can develop. And Lyme disease, pretty much, even though it's not due to a heavy metal toxin like mercury, it's still due to the toxins produced by the pathogens from the Lyme pathogen, the Borrelia. And again, depending on the person, I mean, one will hit one neurologically hard, others will hit the other ones systemically hard. I will tell you this. My premise is that all disease has to do with not having normal intracellular oxidative stress, which means normal intracellular vitamin C levels. And when you can get a normal intracellular vitamin C level, you have achieved your therapeutic goal, and that disease or infection, at least as far as that one cell goes, no longer exists. It's really that simple. It's not necessarily that simple to get there, but that is the goal, and that is what you try to target all your therapies at, with this goal in mind. Now, there's been a number of cases, and I don't necessarily recommend it for reasons that'll be obvious, because it can be economically demanding and perhaps potentially disappointing. But a lot of Lyme patients early on, back in 2015, I was talking in Tennessee to a group about vitamin C. It was a little hospital. And about a week later, the nurse that was sort of in charge of it, really more than the doctor was, said, well, Dr. Levy, this Mrs. Jones wants to take a lot of vitamin C for her Lyme disease. And I said, well, sounds great. And so she pushed and pushed and pushed. And so she took 50 grams a day, pushed it up to 75, pushed it up to 100. And she did this for 20 consecutive days. Now, the downside of this was, for 20 consecutive days, she didn't feel better at all. But she kept on remembering what I said. And basically what I said before is, if vitamin C is not working for you, you're not using enough. Well, I didn't necessarily have her scenario in mind when I said that, but nevertheless, that was what was fixed in her head. And literally on the 21st or 22nd day, the nurse and her said it was like a light switch had flipped. And her Lyme symptomatology was completely gone. Her blood work had completely normalized. And again, following what I said, she was so compulsive to say that, and we want to make sure it's knocked out. So she continued that high dose vitamin C for another week. Now, this is, there are a lot of other different things we can add now to different ozone therapies, hyperbaric oxygen, different applications of hydrogen peroxide, intravenously and nebulized, all of which, as a package deal, I think if we can actually ever get a group together, we can see significant positive results the vast majority of the time. I got to say, this one more case, because it's such a compelling case study, a physician who had listened to Dr. Honeyhacky and I talk in the Reardon Clinic about IV vitamin C, some 10, 15 years ago, went back to his clinic in Idaho. He gives an enormous amount of vitamin C, and he relates this story, and it's very compelling emotionally, so excuse me. But he said this little emaciated young woman, about 85 pounds, virtually comatose, was brought in by their family on a stretcher. And the diagnosis was advanced Lyme disease. And I don't know that I said this, but this was related by this doctor who later said, well, all I remember is When Dr. Levy said, how much vitamin C can you take? He said, as much as your cojones will allow you to give. Well, anyway, he started this little emaciated lady on 100 grams of vitamin C intravenously. Didn't give it rapidly, gave it over about 6 or 7 or 8 hours, so the extent of his clinic being open. And the family stayed in a little trailer next to the clinic. And he was stunned. The next morning, he came in and she walked into the clinic. Now, she wasn't well yet, but remember, she was comatose before. Okay, so
Wow.
he continued this massive program, and shortly thereafter, she was discharged. A year later, she's engaged and got married and has a bunch of kids. So Lyme can be conquered, and vitamin C is an enormously critical part of it. I'm not saying there might not be ways you can't conquer it without vitamin C, but you got to remember, in any advanced infection, one of the paramount premier problems is the infection at the same time it's doing its damage to the body, it's massively using up and depleting your vitamin C stores. So regardless of whether or not you consider it to be a primarily disease designed for vitamin C, you're not doing the patient any favors if you're not making sure as best as possible that you're keeping their vitamin C levels optimal while you do whatever else you want to do, whether it's ozone therapies or other things like I mentioned. So Lyme can be cured. All right. What percent of the time? I'm not sure. I will say another doc, after he learned about the experience that we had with the first lady, he claims, and I have no reason to discount him, that he did virtually the same thing with 13 or 14 more Lyme patients, going up to 20, 21, 22 IV infusions of vitamin C, and with very poor resolution early on and dramatic resolution at the end, and in his words, complete cures. So what percent of the time? I don't know, but I think if it's done right, a very large percent of the time, we can knock this thing that has just totally destroyed so many people's lives and so many families' lives.
I'll agree. It's pretty extensive from what I understand. And one of the things people ask me is, does it matter what company you use or what vitamin C solution they have? And the one I use out here in the country where I am, I have a nurse that will come and do IVs for some of my clients out here, and she gets her vitamin C from a compounding pharmacy. And I was just wondering, is there any particular question that you would suggest people ask a vitamin C IV business about their vitamin C or their program?
Well, no, there's not that many types per se when you're talking about intravenous. You either start with ascorbic acid, but you end up buffering the ascorbic acid with either sodium bicarbonate, so that you don't keep the pH too low, because what you don't want is an uncomfortable IV, causing discomfort in the vein, and that involves getting your pH as close up to 7 or so as possible. And really, for all intents and purposes, if you have a compounding pharmacy who can do it for you, and many of them can, is to just set up for you directly sodium ascorbate, because sodium ascorbate as vitamin C solution comes into just a perfect pH. So there's no pH problems with having any discomfort on the IV. And I got to say this too. I don't know what some people do out there, but I run into so many people that say, oh, I gave that, and it hurts so much, and this, that, or the other. I don't know what their technique is. I don't know what they add to the solution. I don't know what their base is. But the Reardon Clinic has given 150,000 IVs like this with virtually not only no problems at all, but very rarely even minor discomfort in the vein. And yet I've had docs say, oh, I can't do that. It just burns the veins. I don't know what they're doing. Okay. But all I can say is they should come to a course or something that Dr. Honey Hackey or I put on, and we can make sure that that won't be a problem in the future.
Great advice. And then you also speak a lot about liposomal and liposomal vitamin C. And are all of those pretty much similar, or is some better than others, or are some just pretending they're liposomal? Or do you have any thoughts on all of these? Because people get confused on which supplements to get and what to use. And if they're not able to get a vitamin C IV or they can't afford it, they may go with the liposomal vitamin C. And I'd love your thoughts on that.
No, it's a great question. And the fact of the matter is, I got on board as a consultant with Live On Labs about 16, 17 years ago. They had only been in business for about a year when they contacted me because they knew I played around with vitamin C and they wanted to know what I thought of the product. Bottom line is, I saw some results with the oral liposomal vitamin C that I didn't necessarily even see with intravenous. Now, I'm not dissing intravenous. I mean, basically, if you're sick, you'd like to have both. You'd like, because they have, unique delivery methods inside your cell and into the immune cells and into the blood. So, I mean, as long as availability and expense doesn't prevent you, you'd want to get them both. Now, having said that, then over the course of the next, 17, 18 years, Live On's business just skyrocketed. Why did it skyrocket? It skyrocketed because most people, after they first started taking this, had a sense of well-being that they never had before, because they were getting an effective delivery of vitamin C inside their cells that was not being seen with regular vitamin C supplements. Well, you can only imagine what this did. I mean, I can't tell you how many pretenders have come along since then. And bottom line was, early on, the Live On was going to the trouble of testing these things just to see what was going on. And after not finding any of them to have liposomes in it, I mean, we just basically, in the supplement industry, you can be a fraud as long as you want until the FTC or FDA comes along and says stop. And if they don't, you can promote your fraudulent products forever. The thing that sustains most of these others, liposomal, that aren't liposomal products, is they do still have vitamin C. So if somebody wasn't taking vitamin C before and is now taking any form of vitamin C, they're going to feel better. Are they going to feel as good as they could with the liposomal, or get the incredible anti-cancer, anti-atherosclerotic effect of the liposomal? I don't think so. And so out of this also sprung the homemade liposomes. Again, the homemade liposomes actually seem to form what's called an emulsion, which actually allows better absorption into the blood. But that's not the goal. The goal is uptake inside the cells, not delivery into the blood, uptake inside the cells. Because it's my impression that if you take 5 grams of the liposome encapsulated vitamin C from Live On orally, that will get inside your cells more effectively than 5 grams of unencapsulated vitamin C taken intravenously. So it all has to do with the fact that the liposome is like a very tiny cell. And when it hits another cell, it merges by reverse pinocytosis into the cell wall and pushes the contents inside. So the short answer to your question is, there's one very good form of liposome encapsulated vitamin C, and that's Live On. If there's another high quality liposome supplement, I don't know what it is.
Okay. Those are great questions. And I do Live On Labs liposomal vitamin C, and they also have magnesium and B complex. And are those liposomals more absorbable into your cell as well in that form, or does it matter as much with those as it does with vitamin C?
No, they absolutely get inside your cells better. And it's especially important with magnesium. Magnesium, you need to get inside your cells at as high a concentration as possible. And without a special delivery form, the levels of magnesium outside the cell are very low compared to the levels of magnesium inside the cell. So all things being equal, you're going to have a tough time going against the concentration gradient of low outside to concentrated inside and even bring more in. So that's where the liposome form is very important for the magnesium. And, you mentioned the book earlier. There's nothing more important than maintaining as close to normal magnesium levels inside your cells as possible.
That's so important to know. And one of the things that I've also found with a lot of people is that they seem to be low in B vitamins, and they, like my daughter has to have methylated B vitamins, and she has a lot of trouble getting those into her cells. Do you have any thoughts on the B vitamins? And the Live On Labs has a B complex that is liposomal, which I would guess is more absorbable into the cells as well.
Well, it's not like I can point to any studies on this, but based on what I've said about the liposome technology and the quality of the liposomes that Live On Labs produces, is yes, this is a highly effective and more effective way of getting all the B vitamins where you want them to get. Because, the vitamins are good anywhere in the body, but all things being equal or being taken into consideration, you really want to get those vitamin levels as elevated inside the cells as possible, intracellular versus extracellular. And that's the whole goal of a quality liposome encapsulated supplement, is to get the payload inside the cell, also without the consumption of energy. That's a big one too. A lot of times you need to use up energy to get an energy delivering product inside the cell. And you bypass that need for use of energy to do that with a quality liposomal product.
Okay. So, such great information. And so I've had quite a few people contacting me recently, and even for their animals, with kidney problems, really serious kidney problems. And with vitamin C IVs, liposomal vitamin C, and the liposomal magnesium or magnesium chloride foot baths, would those be helpful in helping the kidneys restore themselves to health?
Absolutely. And this is a little known and little emphasized point, but kidney disease, like disease anywhere else in the body, is caused by increased oxidative stress inside those cells, which brings you back to point zero, which is that vitamin C is your pivotal substance in stabilizing and reversing oxidized damage to biomolecules. There's no downside at all to using vitamin C in chronic renal disease patients. If you get to the point where the patient has literally no renal function at all, then you need to be expert with your dialysis so that you don't take in more of anything, not just vitamin C, but anything else, because you have to dialyze it out again. But while you still have renal function and you're still maintaining a good urine flow, which a lot of people have, even with mild to moderate degrees of renal failure, they still have good urinary output. Vitamin C, especially in an experienced person's hands who's given lots of IVs in these circumstances and knows how to adjust it based on following different lab work, consistently see not normalization, but significant improvement in the renal failure numbers.
Wow, that's great. I would love to go and talk about the dental part of how that affects everyone's overall health. And I know that a lot of people really don't realize how impactful their oral health is to their overall well being. And I know it was a talk from you, or I'm pretty sure I've always been using food grade hydrogen peroxide. I actually keep like a gallon of it in my refrigerator at all times, 35%. I use it for all kinds of things, but I believe it was a talk you gave once on how you should put a few drops of it in your water when you're rinsing out your mouth after you brush your teeth. And I've been doing it ever since and really recommend it to people. And I have found it really feels great and makes my mouth feel so clean when I finish brushing my teeth. And I would love for you to expand on. I know we don't have a whole lot of time, but we have about 15 minutes before we need to start closing the show. And, maybe you could share a few of what you think is the most important things people might want to know about dental care or oral care and how it really does affect our overall health and well-being.
Well, in a nutshell, effective disease treatment involves two things. It involves repair old oxidation and prevent new oxidation. That's it. If you accomplish both those goals, you resolve the disease completely. Now, obviously, it's difficult to resolve those goals completely, but that is the goal. If you can get in there and reduce all the oxidized biomolecules that have been tortured by the toxins, and at the same time you can identify and eliminate or prevent new toxins from coming in, you've got a normal body, once again, assuming you've got good nutrition. Well, as it turns out, and this Dr. Huggins described many years ago to me, somewhat sarcastically, when I was asking about this stuff, he looked at me and said, Tom, I said, yes, sir. He said, don't you realize you can't dry off while you're still in the shower? And that, which means, how can you expect to recover from toxicity if you're not stopping the new toxicity at the same time? So it's not enough to dry off. You got to turn off the shower. So not enough to repair. You got to stop the new toxins. Well, as close to 100%, greater than 95% of the time, all the significant new toxins in your body are coming from pathogens in your mouth. Period. End of story. They're coming from gum disease, infected teeth in the form of root canals, infected teeth in the form of what's called asymptomatically pain-free abscess teeth, which is the really thing that the book Hidden Epidemic focuses on. Chronically infected but normal appearing tonsils and chronically infected sinuses. And then secondarily, even while you're working with this, these things are also continuing to colonize your nasal and oral and pharyngeal areas with what's called chronic pathogen colonization, which is not a gross infection, but just like it says, they're sitting there, they're existing, they're not proliferating rapidly, but they are growing. They're protected by a biofilm. And then what do you do with those 24/7? You swallow them. And so when you swallow them, what do? Well, all disease is excess oxidation. So when you swallow a pathogen, it has endotoxins, it has exotoxins, it has its own pathology in screwing up the microbiome. When it does die and rupture, it releases a huge amount of free iron, which is literally the fuel that runs pathogens. The more free iron you have, the more pathogens proliferate. Those go down there too. So you're literally showering your gut 24/7 with the types of pathogens that you're trying to get rid of out of the mouth. And what does this do? This then brings in the factor that everybody talks about today, the deranged gut, the abnormal microbiome, the leaky gut, none of that would exist if you correct these other factors. And I've had so many people tell me, as soon as they start nebulizing with hydrogen peroxide and stop swallowing this stuff, their bowels become incredibly normal in a day or two. I had people with chronic diarrhea for years resolve in a few days. A Crohn's disease patient, which is a sort of for life type thing, resolve after a couple months. Somebody in her entire family with black mold fungus problems, had to move out of their house. Kids were in the ICU, tried everything possible. After she nebulized with hydrogen peroxide, everything started going away. So the thing is pathogens and their toxins rule the roost in causing disease in the body. And also because of what happens in the gut and the leaky gut, what happens? They go into the tissues throughout the body. So the reason you have a chronic disease is because, remember, you have more new oxidation taking place on a daily basis than you are repairing old oxidation. So that means the disease is progressing. If you can identify and knock out the chronic pathogen colonization in the tissue, and they've identified it in Alzheimer's disease, they've identified the oral pathogens there. You have oral pathogens documented to be growing in Alzheimer's tissues inside the brain of these patients. Well, what is that doing? That's supplying a huge amount of new toxin and pro-oxidants, and you're never going to reverse one of those patients until you get that out of there. And in fact, Dr. Huggins, many years ago, did have a number of patients, Alzheimer's, cleaned out their mouth, good supplements. I mean, they returned to normal. Alzheimer's is not an incurable disease. It is if you don't know what the heck you're doing or what causes it.
Right. That's such great information. And I really do love my hydrogen peroxide, which I use so many things. It's really wild. But when I was 2, I got an overdose of penicillin and I was left with acute anemia. And so my parents, just not knowing any better, were constantly having me eat liver or pushing iron supplements at me. So for people today, I get a lot of people who contact me and they just feel absolutely no energy and they feel extreme fatigue. And, I think a lot of their doctors prescribe iron. And so what would a healthier version of that be in your opinion to help them get their energy levels up or their health back? I suppose it's really just low nutrients.
Supplementing any form of iron is absolutely the single worst thing you can do for that patient's health. Nothing worse. I mean, the patient is literally being poisoned. I mean, poison is a pro-oxidant, is a toxin. They're all synonyms. They all mean the same thing. Okay, so you're taking a poison on a regular basis because you have some sort of fanciful idea that iron is good for you. A tiny amount of iron is good for you. Above that, it's the most toxic substance on the planet. I call calcium, iron, and copper the 3 toxic nutrients. You need absolutely all of them in limited amounts for good cellular health and life. And all 3 are part of the primary components of inflicting and causing cell sickness and cell death when you get them above a certain level. I mean, calcium, for example, is a straightforward carcinogenic agent. You take too much of it, you promote cancer everywhere throughout the body. And that's, of course, covered in death by calcium. Iron, you should never supplement iron if you have a normal blood count. And if you don't have a normal blood count, what a lot of the crazy oncologists do is their cancer patients are anemic and say, oh, anemia iron. Yes. No, it has to be a specific type of anemia, which is a hypochromic microcytic anemia. Small cells with a low concentration of hemoglobin. Those are anemia cells that due to low iron. The anemia of chronic disease, all those oncologists are doing is making their patients sicker.
Wow, that's really important information for people to be aware of. And one of the things I've studied over the years is the B17 vitamin, which is also called Laetrile, which is like a bitter vitamin. And I know they did some studies. I think it was Sloan Kettering that did studies on Laetrile and cancer cells and found it to be very effective, but the pharmaceutical companies didn't like their results, so they made them redo the test with not enough Laetrile so that it didn't look like it was effective, and then they released those results. But do you have any thoughts on that at all? Do you have any research or thoughts on that in that area at all?
No, I mean, I'm minimally familiar with the subject, but I've never really looked into Laetrile that much. Not to put Laetrile down, but there's just so many other things I know of that work so well. It just didn't seem to be something that I needed to look into. Now, having said that, I don't put down anything that I haven't properly researched. So I'm not saying Laetrile is not useful, and maybe not even possibly even the therapy of choice for some people. I'm just saying I'm not the expert to answer that question.
Thank you so much. And so if someone was going to improve their oral health and they used a tongue scraper and they used a nice healthy toothpaste or tooth powder. I've been recommending tooth powders to people because a lot of these toothpastes are so toxic, with literal poison control warnings on the boxes and toxic ingredients like fluoride and things. And also I found that the glycerin they put in toothpaste, they like seal off the tooth so they're not able to absorb the minerals that would make them stronger. But having to do that and then using some kind of a mouthwash. I know a lot of these mouthwashes have alcohol in them, and they also like kill all bacteria. And quite literally, I think some of those are very harmful to your dental health. And I don't use those. I use one with food grade essential oils and colloidal silver. But do you have some recommendations for people to improve their oral health? And what would those be?
Probably the big two right there is the tongue scraping. That's important. And the other one is to forget about flossing and use a water pick on a regular basis, a couple hundred cc's, and with about 30 to 40 cc's of 3% hydrogen peroxide added to the tank. And after you've done that a few days, unless you had advanced disease before, you have pristine gums, and that's where all dental disease starts. Teeth, unless the tooth is old, decrepit, and you chew on it hard and split it, and so that you get pathogens into the core, into the pulp. If that doesn't happen, the only way your tooth gets infected is by infected gums that work their way down between the tooth and the periodontal area, and then finally form an abscess at the tip and retrogradely infect the pulp. So you keep your gums healthy, you stay healthy. Bearing in mind, though, if you had any infection of your teeth and gums for an extended period of time, the tonsils must be treated, because the tonsils harbor a great deal of pathology and toxin and infection while looking normal. And too many people that go to the trouble of getting the infected teeth taken out and aren't aware of the problem with the tonsils can still eventually have the downstream problems of heart problem, breast cancer problem. But in a nutshell, it's easy. You find a dentist that will do direct ozone gas injections into the tonsils. This heals them up very nicely. And in addition to that, we're realizing that, and do both of them, not one or the other, putting a drop or two of 1% methylene blue directly on each tonsil, it gets in it and cleans it out very well. And you document this, if possible, by showing your C-reactive protein test, which elevates with inflammation, starts to go down as you treat these tonsils. But the tonsils must be treated. This is one of the things that has evolved in my core of knowledge that just can't be overlooked if you want to do your best for keeping your patient from having a heart attack or keeping her lady from having breast cancer.
Interesting. That is such great advice. And Dr. Levy, we've got about 5 minutes left, and I would love for you, before we get too far to the end, to share any events you may have coming up. I know every once in a while you do, and I would love for you to tell people what's on your website, peakenergy.com, and what they can find there, and anything that you have coming up that you might want to share with our listeners.
Well, I will be doing another conference or two. I don't have dates yet between now and the end of the year, in which I actually teach my protocols, teach my philosophies and my protocols in conjunction with the doctor's ozone group, because it's a natural marriage, because ozone is just as important in all of this, and its different applications as everything else I've talked about. So I put that together. Then I have specific protocols. People continue to ask me, well, where can I get treatment like you're talking about, like you're writing about? I said, well, I don't have anywhere to send you. Well, that's the idea. Is we already completed one, so we have about 35 or 40 practitioners out there now that presumably are open and eager to use the methodologies that they studied with me. And if somebody's interested in that, just send me an email, and I'll make sure you get on a list where you can be notified when that comes up. It's not limited to practitioners, but it's primarily directed at practitioners, because the bulk of it is to tell treating healthcare practitioners, how do you best resolve X, Y, or Z. But for the motivated lay person who just wants to increase their own information base, that's fine too. I mean, we certainly don't reject that. And then we have a second day where we have hands-on intravenous applications of vitamin C, ozonated blood, and methylene blue infusions, all to give everybody a little additional feel for the type of protocols we're talking about. And that's you can give, my email, so you can give out my email at the end, and anybody that sends me an email specifically ask for the information, and I'll give you that, plus some good downloads. The website is peakenergy.com, and that's got a lot of information on it too.
Yes, and on your website, you have some excellent articles people can read. And also there's a contact button. So if you do go to peakenergy.com, it does have a little button you can click on to contact Dr. Levy that way as well. And I think that's so wonderful that you are doing these types of workshops for people. And Dr. Levy, is that going to be in Florida where you are right now?
Right now, the game plan is the group I'm working with is being very nice to me. So we have it in Fort Lauderdale, about a half an hour from my house. And I can tell people I'm a pretty experienced flyer. There's no more delightful airport to fly into than Fort Lauderdale. So generally have it, that's where we had this first one. And right now the plan is that's where we'll have them in the future. But I can't say, we might run into a group somewhere in the country large enough that we would go to them, but that's not the case right now.
Well, I'd love for you to come to Texas. I mean, you and Dr. Artis could put something together in Dallas. But we have like 1 minute left, and I would love for you to share with our wonderful listeners around the world just a parting thought, maybe something they can implement right now that can help improve their health and their family's health. That would be lovely.
Well, I think more than anything else, after this horrible pandemic and all, people sadly, but finally are realizing that modern medicine is not the wonderful institution that everybody thought it was. I mean, I'll take it a step further. I think modern medicine, on the whole, a lot of exceptions, does more harm than good. Why? Because they always use toxic pharmaceuticals, and they always suppress excellent alternatives and excellent superior products like vitamin C, like hydrogen peroxide, like ivermectin, like hydroxychloroquine. So no, I mean, people are finally realizing the lack of level of concern for their welfare versus just fueling the mega greedy healthcare machine. So be diligent in finding a doctor that will answer all your questions. If they won't answer your questions and don't want to spend time with you, don't walk out of that office, run out of it.
We are also honored to have you join us today. And I just so look at you with inspiration, with your courageous life you've led, and sharing your incredible holistic suggestions and information and research with all of us. And I just want to thank you from the bottom of my heart. And hope you'll join me again one day for one of these really in-depth conversations. It's just fascinating to me, and I just really am so happy to have you join me.
Very good. Thanks for having me on, Nancy.
Thank you. And for everyone out there, we send you blessings. We wish you great health, and I will see you next week.